Bismillahirrahmanirrahim. My name is Professor Dr. Hussain Baksh Polachi, and I am working as a professor and chairperson of Department of Community Medicine in Isra University. Before this, I was dean in Liaquat University of Medical and Health Sciences, as well as in Dow University of Health Sciences, Karachi, and I got my FCPS Fellow of College of Physician Surgeon in 2011 from College of Physician Surgeon, one of the best medical training institute and postgraduate institute in Pakistan. Uh, so I welcome and say Assalamu alaikum to my viewers. This is first video which I am just sharing with you along with my slides, and basically this is based on my lectures which I deliver in Isra University. So mumps is today's topic which I will discuss with you people, and hope at the end of this presentation you will learn a lot about this mumps disease. So main objective is to give overview about the mumps and how this is affecting the young population of Pakistan and how vaccines can prevent these diseases. So mumps basically is a childhood infection, but the adolescents can also be affected. Uh, you can see this slide, uh, which shows the picture of a boy, and the neck is the main area where swelling and difficulty in chewing, fever, and other symptoms are there. So basically, this is a viral disease, and you can see the picture of the virus of the mumps, and it is basically a RNA virus, as COVID is also a RNA virus. And you can see that there is a red dot or a circle which shows that it contains polymerase. And at the top, you can see that there are spike-like structures also, and we call them as HN proteins. Uh, then you can see that how the gland, which is parotid gland and sublingual gland, submandibular glands. So basically, parotid glands are at the pinna of the uh, ear. The infection starts and swelling actually occurs, and sometimes it is called also a uh, bull neck swelling also. But in local language, Kant Mala is another beautiful name given to Kant. Is just a garland or a beautiful ornament which is uh, worn around the uh, neck by the male and female both. So this is a local name which you can also use. This is a Kantmala like a disease, and I think you will like this. Then is the data about this, and you can see that up to 10% of the mumps patient develop aseptic meningitis, and a less common but more serious complication is encephalitis, and pancreatitis also there, and it also affects the reproductive organ, ovaries and testes, and can lead to the infertility. So this is one of the viral infection which not only gives you a difficulty and fever, pain, and chewing difficulty, swelling, and even your social adjustment. But arthritis and pancreatitis are both important. So the GPs and the general practitioners should take care of this disease. Then there is another busy slide. The incubation period is about 16 to 18 days, means after infection, within 16 to 18 days or more than 2 weeks, The symptoms start developing: low-grade fever, anorexia, malaise means you are not feeling well, headache, widespread systemic involvement, as you have seen that parotid glands and other things are also involved. And uh, 10% of cases, EPD dynamo arthritis occurs in about 25% post-pubertal age, particularly in female. Men who contract mumps, in one large cohort study, the median age of the mumps was about which suffered from the arthritis were 29, though it is a childhood disease, but it affects the more to the young age population. The orphans and people living in the unhygienic conditions, they suffer more from the mumps disease. Then another slide will show you that keeping in mind that the disease may still occur in susceptible adults, uh, so we should have a great prevention about this. So this shows that if vaccine is given, then the number immediately drops from this is a slide showing some countries who used the mumps, we call it MMR vaccines, and some countries they did not, and some used one dose and some used two doses. So where two doses were there, then the top countries in the slide, they are about 10, 12 countries of the Western countries. They have almost controlled and eradicated the mumps from their country due to their vaccination. Uh, then coming to the reference, this picture was taken from the Bulletin of the World Health Organization 99, and we will give you this reference in the description also. This is basically a vaccine. We call it MMR, measles, mumps, and rubella vaccine. This is a triple vaccine, very effective, and you can see that how this vaccine can be given. This is intramuscular, and the dose is also recommended on the 0.5 cc normally, but you can read and you can have a description of the dose on the vials and company and the particular brand of the vaccine. So it is available in Pakistan. Normally, it is not included in the EPI program. So prevention is the oral hygiene, hand hygiene, and vaccine is the great technology available. The name of the vaccine is MMR commonly, and it will protect three diseases from measles, mumps, and rubella. All are viral infection. It is safe injection or vaccine, and we will recommend all the children viewers. So from post-grad point of view, the questions normally appear in the MBBS as well as in the FCPS and other medical subjects. So the normal question is about what is the name of the vaccine, what is the mumps virus, either RNA or DNA, and what are the symptoms and incubation period. I think Dr. Hussain Baksh Kolachi YouTube channel will give you the latest information not only on public health issues but nutrition and other important infectious diseases, so that the students community as well as people who want to know about these diseases and how to prevent them. I think this video and the Dr. Santosh Kolaji YouTube channel will bring new, updated, and correct information. And the students of MBBS as well as FCPS Part 1, Part 2, and not only in Hyderabad but in other countries can also learn from these uh, topics. And public health is, we say that if the life expectancy has increased 30 years over last century, 20 years are from the public health side, and all other fields which normally we say clinical or curative medicine has increased only 5 years. So, Assalamu alaikum and Khuda Hafiz. Please do share and send your comments about the presentation. Any clarification, Dr. Hussain Bashkulachi YouTube channel is ready to answer that. Thank you very much.